Severe arthritis of the ankle can be a very painful experience and can limit activities such as walking and even working. Changing your everyday activities, resting your ankle, decreasing activity, using medications such as analgesics and non-steroidal anti-inflammatory medications, bracing it, all these things can help to reduce pain. In time, though, pain may become so severe and activity may become so restricted that an ankle fusion may be something that you'll eventually consider. An ankle fusion is a permanent operation. It's not something that will change down the road. And through the years, many patients have voiced their anxiety about this operation and just asked the questions, is this the right operation? What are the risks and complications? Will it help? Is it the right choice? And we've made this video in order to help you understand more what an ankle fusion is all about. First of all, let's look at the anatomy of the ankle joint, of a normal ankle, because I think that helps you to understand this operation more. The ankle joint is made up of three separate bones. The talus, which is the lower bone of the ankle joint, this being the ankle joint, the shin bone, or tibia, and a smaller bone on the outside of the ankle, the fibula. With an ankle fusion, all three of these bones will grow together to form one single bone. A normal ankle joint has a thick articular cushion, and as arthritis develops, as we see in the next x-ray, the joint cushion narrows. It wears down, and with this wear comes pain and decreased motion. This is an x-ray of Mary, a 40-year-old female therapist, who had an ankle injury several years before. And you can see there's marked thinning of the articular cartilage of the ankle joint with this arthritis. Let's look at an ankle model again and see how an ankle fusion is done. The smaller bone, the fibula, is actually temporarily removed in order to expose the outer aspect of the ankle joint. At the time of surgery, any remaining bone is removed from the talus and the tibia so that these surfaces can be compressed together at surgery in order to bring a fusion about. In this model of a fused ankle, we see that the joint surfaces have been compressed together. There are several screws that are used to do the operation, but they're almost flush with the surface of the bone, and it's rare that they ever are bothersome to a patient. Let's look at an x-ray of a real fusion and see what these screws look like. In this post-op x-ray of Mary's ankle, we see that the screws are almost entirely within the bone. These are the screws that we saw on the model, the screw heads. These screws stay in permanently. The small bone, the fibula, has been fixed to the outside of the tibia with these two screws, and it then grows into one solid mass with the talus, the tibia, and the fibula. I think it's helpful for you to realize that many of the questions, worries, and concerns that you have are the same things that other patients have talked about preceding their ankle fusion. For example, Mary, who we showed x-rays of previously, we talked with her about her upcoming surgery, and then she decided to go ahead. And let's see what she said prior to her ankle fusion.
It started to be painful mostly when I just did an activity. Like if I played tennis or something like that, I would kind of pay for it. And then it started to get where it was aching all the time, disrupting my sleep. It started to bother me if I just did any type of walking. Well, when I'm walking on it, I would say constant pain. About 3 months ago, it got to where it was either like a flare-up or something, but just, to me, it seemed like it just hit a point where everything I did, just standing, and I felt like I was starting to feel more wear and tear on my other leg and also my back, and noticing that I very seldom ever really walked through on that leg. Kind of took a real short step, and that I always kept all my weight on my good side, which was starting to feel like it was going to be my bad side pretty soon. I keep thinking it's such a permanent step, and fusion is supposed to be permanent. and that's what I want to have happen, but it still seems like, since I'm not even quite 50, that it's a drastic decision.
Then we talked to Mary after surgery, and let's see what she had to say then. Well, Mary, we said we were going to get together at 6 months after surgery, and here a whole year and a half has passed, and I'm really interested to know how you're doing.
I'm doing wonderfully. I can't really believe that there is no pain, and with my ankle, there is nothing that has made me feel like I was limited.
So there's life after an ankle fusion.
Yes, yes.
You know, when we talked a year and a half ago, before you had surgery, you actually, in your work at the Elks as a therapist, you were using crutches and actually using a scooter to get down the hallways. How's life changed now?
I feel like even walking on concrete, which is what I walk on at work, that I don't have any pain with walking. The speed of which I can walk is much faster, and that it hasn't interfered at all with work. And I don't go home at the end of the day with any pain.
Do you take any pain medicine at all?
No.
Okay.
I can't believe how much pain I had before and how now it's all gone.
Well, you said that you thought you'd be quite surprised with your amount of pain relief. Is that true?
Oh, completely. And people, I think, are still amazed at how often I say, I can't believe that I'm doing this. And when I'm done doing it, I don't have increased pain or that feeling that, was it even worth it to try?
So life's pretty good now as far as
Yes.
your ankle.
Mhm.
And as far as if I asked you if you'd go through it again, what would you say?
I would have probably gone through it 5 to 10 years sooner.
But it is kind of frightening to think about the permanency of
Yes.
it, isn't it?
Yeah. It, you know, you get very used to the pain. And I think that you almost get to the point where you don't even realize that you're in so much pain.
So it's been worth it?
Oh, yes, definitely.
Let's talk to 2 other patients and see how they've done after surgery. It's a pleasure to welcome both of you back to the office. Colleen, you're 6 years since your ankle fusion, and
Right.
you originally broke it, you broke your ankle, whereas Marge, you were skiing when you broke your tibia, and then many years later you developed ankle arthritis and came to a fusion. But you're 6 years and you're 5 years, so it's interesting to talk to you and sort of reflect on how uncomfortable you were before and what your symptoms are now. Colleen, were you in a lot of pain when you had your fusion?
Yeah, before my fusion, I had a lot of chronic pain, and you learn to live with chronic pain, and I had lived with it for, 8, 9 years. And I researched quite a bit before I would even submit to an ankle fusion.
Marge, how about you as far as pain prior to your fusion? Were you in a lot of pain?
I was in a lot of pain after activities. Anytime I would go up a long flight of stairs, like to the Bronco Stadium, up to the top of the seats, or at the pavilion to go to a basketball game, going up and down those stairs, after a hard day of skiing on the slopes, downhill skiing, or I'm a dirt bike rider. If I'd go out and ride my dirt bike in the mountains, I'd come home the next morning, I would be all swollen up and I wouldn't be able to walk, hardly get across the room until I got motion going again. And it took a couple of days after that kind of activity for me to get back to a normal stride. I'd have to take a lot of ibuprofen to live with it, but it was painful. For 5 years I lived like that, and I couldn't think of having to do something that would debilitate my activities, because I enjoyed doing all these sports and activities and wanted to be able to continue them, and so I kind of lived with it. I was in pain for about 5 years. I wished I'd have known earlier what I could have done.
Colleen, as far as activities now, you were pretty limited prior to your fusion, I would assume.
Well, I tried not to be, but yes, in fact, I really was. I mean, I would stand and do lectures, and And by the time I was through with a 4-hour lecture, I could hardly move, just like Marge was talking about. But I, too, like Marge, enjoy life. And since my ankle fusion, I've been roller skating and horseback riding, bird watching, hiking. I just take my ankle for granted now.
Yeah, me too. I can't believe I stood with the pain and now pain-free, anything I do. I don't have any pain.
And have you returned to skiing?
Oh, yes. I couldn't believe that I could go downhill skiing, go over the bumps and everything. Of course, the boots were a good support, but now I can ski and I don't have any pain the next morning. It's wonderful.
That's great. Were you worried at all about how you would walk after an ankle fusion?
Oh, yes. I'm amazed. I don't have anybody come up to me and say, "What's the matter with your ankle?" They don't even notice I have a fused ankle. I'm normal again.
But inevitably, people at work would say, "Oh gosh, did you hurt your ankle over the weekend, or what happened?" And I say, "No, I broke it in Mexico City, and I've got chronic pain, etc." Nobody asks me anything about my ankle now. They just take it for granted.
After surgery, the postoperative care is very important. The patient is frequently casted for 12 weeks, and 6 to 8 of these weeks, they're non-weight bearing using crutches or a walker. And their cooperation is very important in not putting weight on the foot during that period of time. And afterwards, it does take time to get used to a fusion. You're just not magically better when you come out of the cast. And often we use physical therapy to help with that recovery process.
I can remember the first day in physical therapy. I tried to walk a straight line. I couldn't. I didn't have the balance anymore. And Paul over at the Institute, she worked really hard with me and got me so I could walk and stand on one foot. And finally I had the strength enough where I could walk down the street with hardly any limp at all. I think the most exciting thing that I can remember of the rehabilitation period was that whatever I did, I didn't have any pain from doing it.
It was such a wonderful experience to be pain-free. I didn't know what chronic pain was until I was pain-free.
Sure.
And then I looked back at it and said, how could I have lived with that? You know, I must have been a grump.
If you each were going to sum up what the ankle fusion means to you, what would you say?
Oh, it's just opened up life to me again, because before I just couldn't get excited about doing anything because I knew I'd be living with pain for 2 or 3 days after. And now everything's open to me. It's just brought me a lot of joy.
Colleen?
I like the joy part because the world is still at your feet and you can do whatever it is that you really want to do. You've extended life for me. I just love my ankle, that's all.
This is Tom, who's an executive here in Boise, and he had an ankle fusion 12 years ago. Tom, what bothered you most about your ankle that led you to have an operation?
Probably what bothered me most was the pain that was involved that precluded me from a lot of activities, including just walking around. It got to the point where I had to do something to where I could walk without any pain and then hopefully do some of the activities that I was used to doing prior to my injury. I was involved in a motorcycle accident that had a spiral break of the tibia that then damaged a lot of tissue inside the ankle, and the joint itself was damaged, and slowly but surely the joint actually disintegrated. I was a little scared. It was more from the perspective of I was hoping that I could do something other than fuse the ankle to repair the ankle, maybe do an ankle replacement, so on and so forth. Well, after discussions with a lot of doctors, including yourself, Dr. Coughlin, it was pretty much determined that the only thing left to do was do the ankle fusion or not do anything. I would say I'm as active or more than the average person walking the street.
What kind of things do you do?
I do anything, again, out of the ordinary, from roofing to taking care of the yard work, digging ditches, to walking around for a walk with my dog or my girlfriend, hiking up the mountains. I jog. I consider it running, not so much jogging. Bicycling. I used to play football on Sunday afternoons, but I kind of gotten away from that and doing other things. But pretty much anything an active person would do.
And how far, when you do jog or run, how far do you run?
I personally like to run about 2 miles. That's about my length of time that gives me a good workout. And, well, you don't want me to do any running at all.
But we've reached an agreement that you're going to still do the things that you need to do.
Yeah, I am applying myself more and more to like bicycling, road biking, and mountain biking, and that does take some of the time away from running, and I think it's substituting pretty good.
Do you ski at all?
Oh, definitely.
Downhill or cross country?
Downhill. I really don't like cross country, although I snowshoe. Well, the ankle fusion, bottom line, meant that I can do a lot more activities than I used to do immediately prior to the ankle fusion. And it's meant that I can pretty much carry on a normal life. A big step forward. I was looking at probably not doing any activities if I didn't have my ankle fused.
Certainly there are risks with any surgery, but if you're in good health, I think you run much less risk of problems relating to your heart and lungs. But there are other substantial risks that can occur with any surgery, and things such as an ankle fusion, a delayed uniting of this fusion, or even a non-union can be very difficult problems to treat, and you need to be aware of that. Your surgery, combined with my post-operative care, and your cooperation can make a big difference in our success. I believe an ankle fusion, if successful, can make a large difference in your life. In general, I don't think it's advisable to run, although some do, but you can be athletically active, and you certainly can work, and hopefully your pain will be reduced or eliminated. And hopefully the restrictions and discomfort that you've experienced with ankle arthritis will be reduced or eliminated, and that you'll have more joy in your life too.